Section 1. A childhood illness. Understanding German measles. German measles, also known as rubella, is a common childhood illness. It is caused by a virus, specifically the rubella virus. Rubella is highly contagious, meaning it spreads easily from person to person. While usually mild, rubella can have serious consequences for pregnant women and their unborn babies. Fortunately, rubella is now preventable through vaccination. The MMR vaccine, which protects against measles, mumps, and rubella, is highly effective. Widespread vaccination has dramatically reduced the incidence of rubella worldwide.
The rubella virus spreads primarily through the air, making it highly contagious and easily transmissible. When an infected person coughs or sneezes, tiny droplets containing the virus are released into the surrounding air. These droplets can then be inhaled by others who are nearby, leading to potential infection. Rubella can also spread through direct contact with an infected person's respiratory secretions, such as mucus or saliva. This can occur through activities like sharing utensils, drinking from the same glass, or touching a contaminated surface and then touching your face. The virus has an incubation period, which is the time between exposure to the virus and the appearance of symptoms. The incubation period for rubella is typically 14 to 21 days, during which the virus multiplies in the body. During this time, an infected person may not know they are carrying the virus, but they can still spread it to others unknowingly, making it crucial to be aware of potential exposure.
Section 3. Recognizing the telltale signs from fever to rash. The most recognizable symptom of rubella is a red or pink rash. This rash is often the first sign that alerts individuals to the presence of the virus. This rash typically starts on the face and then spreads downward to the trunk, arms, and legs. The progression can be quite rapid, often covering the entire body within a day or two. The rash may be itchy for some people. This itching can vary in intensity, from mild discomfort to more severe irritation. Other common symptoms of rubella include a low-grade fever, headache, runny nose, and swollen lymph nodes. These symptoms often precede the rash and can be mistaken for a common cold or flu. These symptoms are usually mild and short-lived, lasting only a few days. Most individuals recover fully without any long-term effects. In some cases, rubella can lead to complications. These complications can be more serious and require medical attention. These are more common in adults than in children. Adults are more likely to experience severe symptoms and complications. Complications can include arthritis, encephalitis, which is inflammation of the brain, and low platelet count. These conditions can lead to more significant health issues if not properly managed.
Managing German measles, rest, fluids, and time. There is no specific antiviral treatment for rubella. Treatment focuses on relieving symptoms and supporting the body's natural immune response. Rest is important to allow the body to fight off the virus. Staying hydrated by drinking plenty of fluids is also crucial. Over-the-counter medications such as acetaminophen or ibuprofen can help reduce fever and discomfort. It's important to avoid giving aspirin to children with viral illnesses, as it has been linked to a rare but serious condition called Rash syndrome.
Prevention is key vaccines and hygiene practices. Vaccination is the most effective way to prevent rubella. It works by stimulating the immune system to recognize and fight the virus if exposed in the future. The MMR vaccine, which protects against measles, mumps, and rubella, is safe and highly effective. It has been used for decades with a strong track record of success. It is typically given in 2 doses, ensuring long-lasting immunity. The first dose is administered at 12 to 15 months of age, and the second dose is given at 4 to 6 years of age, providing a booster to enhance protection. Vaccination not only protects individuals, but also helps to create herd immunity, a critical public health goal. Herd immunity occurs when a high percentage of the population is immune to a disease, either through vaccination or previous infection, making it difficult for the disease to spread within the community. This is especially important for protecting vulnerable populations. This helps to protect those who are unable to be vaccinated, such as infants and people with certain medical conditions who rely on the immunity of others. These individuals are at higher risk of severe complications if they contract rubella. In addition to vaccination, practicing good hygiene is essential to prevent the spread of rubella and other infectious diseases. Simple actions can make a big difference. This includes covering your mouth and nose when you cough or sneeze to prevent respiratory droplets from spreading. Washing your hands frequently with soap and water is one of the most effective ways to remove germs and prevent infections. Additionally, avoiding close contact with people who are sick and wearing masks in crowded places can further reduce the risk of transmission.